Hello, Andrew Collishaw, and an official welcome to the clinic. So I would have seen you some time ago, not that long ago, and I just wanted to send you a video and cover some important issues that you need to keep in mind in order for you to get the very best out of your treatment. Now, along the way, if you have any questions, if you have any concerns, just give me a call or just make a note of them so that you can ask me next time I see you. It's really important in the healing process that any hurdles that you come across, that we deal with those, that we're able to answer any problems that might crop up. Or if you're finding that part of the treatment isn't working for you or it's too difficult, then you need to let us know, because that can make all the difference between getting mediocre results and getting fantastic results. You see, I want you to get the very best results possible. So obviously, I mean, there wouldn't be any point in aiming for anything less than that. But in order to achieve that, you're going to have to make sure that certain things are being done. And I just want to go through a couple of those things today. So, and one of those things is that if there are any questions or obstacles that get in the way, then just give me a call or talk to me at the next appointment. There's something that you may have heard of, getting like aggravations or a healing crisis as part of the treatment. This can mean that your symptoms get worse. Now, if that happens, it doesn't happen very often, but if it does, just stop the medicine and give us a call. All right, as simple as that. Usually we solve that quite easily. It can happen every now and then with some people, so I just wanted to mention that. So don't stress out if that's the case with you. Simply stop the medicine and give me a call. All right. Now, I would have prescribed homeopathic or herbal nutritional medicine most likely, maybe dietary changes as well. If you're not getting the results that you think you should be getting, then we need to talk about that. You've got to bear in mind what it is that we're trying to treat. Now, if we're trying to treat something that you've had for 5 years, 10 years, 20 years, then that's going to determine how quickly you're likely to see changes in your symptoms. Now, that being said, usually with this sort of medicine and homeopathic medicine, naturopathic medicine, what we usually see are improvements along the way. Little improvements, sometimes big improvements, but certainly little improvements along the way, working towards significant major improvements down the track, hopefully. So even if you have had a problem all of your life or for many, many years, we do expect to see improvements. It might be in other areas, so you might have an ongoing respiratory problem, but one of the first things you might notice is that you're sleeping better. So it might be sort of unrelated, but these improvements will monitor and gauge, and that will help us to assess how the treatment's going. Now, the other important thing to remember is while you're taking medicines, it's really important that you don't start or change anything that you're doing. Don't start any new medications or any new treatments, and I'll explain why. It's fairly straightforward. If you take, say, a different supplement, or you go back onto a medicine that you had a year ago or whatever, say if you then get better or if you get worse or nothing happens, you're not going to know what that medicine or what that treatment has actually done or how it's interacting with what I'm doing with you. So it's really important, certainly initially, just to take what I've prescribed for you, do the things that I've suggested that you do, and don't do anything else. And that's the reason, essentially, because you need to know what's doing what is helping you, what's not helping you, and maybe sometimes what's making you worse. So we need to be very clear on that. After a period of time, it can be okay to reintroduce certain things, but it's best that we talk about that before you go ahead and do that. Now, I just wanted to quickly go over a couple of things about taking medicine. Now, with the homeopathic medicine, if you're taking homeopathy, to succuss, you would have been shown 1, 2. Succussion just means a systematic way of mixing the medicine. 1, 2. 2 succussions like that. And then it's going to be drops. Usually it's 5 drops. Now make sure you're not doing squirts, but literally drops. And you need to do that in the mirror, or you just feel the actual drops, okay? It's really important. 5 drops doesn't mean 2 drops, and it doesn't mean squirts, okay? So just make sure you're getting the right dosage. And just if it's once a day or twice a day, make sure you're doing that away from food and drink, about 15 minutes or so. You need to take this in a clean mouth so that it can absorb in the mucosa. Herbal medicine is a bit different, so you need to measure that out. And you're going to take 5 mils often. Usually it's 5 mils. It could be more, it could be less. And you put it in a small glass of, a small cup, a measuring cup. So measure it out, 5 mils, plus a little bit of warm water, usually. That helps to digest and assimilate the herbs. And most of the time you can take the herbs with meals. Now, you would have been given instruction sheets for your medicines, so I'm just going over a couple of things. With the herbal medicine, it's really important that you shake it, okay? Because what can happen, the herbs and the ingredients are different weights, so they will settle. You need to shake it first thoroughly and then take your dose, okay? So you need to measure it. Don't use this as a measuring device. You need to get a little measuring cup, medicine cup, and do it that way. 5 mils is a metric teaspoon. Now, if you're taking homeopathic pilules, then just be careful of a couple of things. So you take the lid off very carefully, be really careful not to spill them all, and just use your forefinger to gently tap 1 pilule into the lid. Now, it takes a little bit of practice, but if you just tap gently like that, if you get like 2 or 3, just, try and tip the excess back. Otherwise, just keep doing it until you get 1, all right? Does take a bit of practice, believe me. Now, these are samples, so but normally don't breathe, don't talk over them, don't cough into them. When you've got your 1 pilule, without touching it on your lips, just pour it into your mouth. In your mouth, let it dissolve for about a minute or so, something like that. Okay, and make sure you put the lid on tightly so they don't fall over and spill everywhere. Now, if part of your treatment involves dietary changes, then it's really important that you, 2 things, that you're able to stick with it, so that we need the changes to be realistic, and we would have gone through that with you. What I don't do is do things that are impossible dietary-wise. I would have worked through with you what's doable and what's not doable. If at any point something becomes too hard, or you're starting to want or starting to eat foods that you're not, that you're trying to avoid at the moment, then we need to talk. We need to iron that out ASAP, because that can really jeopardize the progress of your health and your healing. All right, so basically, I'm here to help you as much as I possibly can, and I want the very best in terms of your health and healing, and we need to do that together. We need to work together. You'll get 120% from me, and from you I expect, well, not 120%, I expect 100% from you as well. And we meet there and we both work and move towards better health and healing for you. And I want to be able to use my 20 plus years of experience as a naturopath homeopath to be able to really move you towards better health and healing, okay? And it's a bit of a journey, whether it's a one-off treatment that you're having, or whether you're on a 3-month, 6-month, 12-month program, or if we're just having a couple of treatments, then whatever, we need to be really focused. And obviously we can go into things into different levels depending on what sort of program you're on, and we just need to move consistently any problems, we talk about it along the way, and we make sure we're moving in the right direction. I'm here to help you, okay? That's the bottom line. All right, I'll look forward to seeing you soon in the clinic, and take care until then. Bye for now.